What does it mean to hold space for a client? Holding space for a client does not mean that we jump right in as soon as they express a problem and we try and fix it, right? That is called the righting reflex. And that's the opposite of what we want to try and do. The idea of holding space for a client means that we allow them to come into the therapy space and express whatever challenge or conflict they're going through in their own words and give their brain some breathing room to think out loud, right? Our job is to observe. We're watching their body language. We're using active listening. We are looking for the words between the words, right? Meanwhile, we're validating and we're asking them open-ended questions to elaborate and expand their thoughts about whatever experience they're going through, right? Because we want to understand what their interpretation is of the challenge, of the conflict, right? And the better we understand what their interpretation is, then later in therapy, we can look for themes of their thought process, right? And we can help them dive deeper into what those things mean to them, and they can learn how to challenge their thoughts or to think more broadly or outside the box, right, about how they're interpreting the events around them. But in essence, holding space just means that we're validating somebody's feelings. We are using empathy. We're trying to put ourselves in their shoes to the best of our ability, and we can only do that if we really understand the language they use about their experiences. And then we observe their body language as they're talking about what it is they're going through, right? That gives us a lot of insight. And then in the meat of therapy, we can dive more into the challenging and helping them kind of work through the logistics of their challenges. But first and foremost, holding space means providing a non-judgmental space for them where they can just be them. There's no judgment. There's no right or wrong. There's no, this is how you need to fix it, right? Because they get a lot of that from family and other people they would go to immediately for support, and that's oftentimes the response they get, which is not what they need. In therapy, we teach clients how to teach others what they need, how to communicate what they need in terms of support, but that comes later. Initially, holding space is just about validation and empathy and active listening. Hey, if you're a therapist, please let us know in the comments what's worked for you when it comes to holding space, what that means to you. If you're a new therapist or studying to be a therapist, hopefully you found this helpful. Please share in the comments what you'd like to learn more about in the art of therapy. All right, until next time, hey, happy 4th of July and have a good week.